Opening snap. The opening snap is a short, high-frequency sound which occurs after the second heart sound in early diastole. It usually follows the second sound by about 60 to 100 milliseconds. It is most frequently the result of the sudden arrest of the opening of the mitral valve, occurring in mitral stenosis, but may also be encountered in conditions producing increased flow through this valve, i.e., VSD or PDA. It is best heard between the apex and the left lateral sternal border, with the diaphragm of the chest piece firmly pressed. In tricuspid stenosis, or in association with increased flow across the tricuspid valve, as in ASD, a tricuspid opening snap may be heard. The tricuspid opening snap is loudest at the left lateral sternal border and becomes louder with inspiration. The following example was recorded from the apex of a patient with mitral stenosis. Now, compare a split-second sound to that of the opening snap. Note that the interval of the second sound split is narrower, about 30 milliseconds, than the distance between the S2 and the opening snap, 60 to 100 milliseconds. The split second. Now the opening snap. Let's also contrast the opening snap to a third heart sound. Note that the S3 follows the second sound by a longer interval and is lower in pitch than the opening snap. The opening snap. Now the third heart sound. The opening snap is best heard with the diaphragm firmly pressed, while the S3 is best heard with the bell lightly held. Murmurs. By definition, murmurs are sustained noises that are audible during the time periods of systole, diastole, or both. They are basically produced by these factors. 1. Backward regurgitation through a leaking valve or septal defect. 2. Forward flow through a narrowed or deformed valve or conduit or through an arterial venous connection. 3. High rate of blood flow through a normal or abnormal valve. 4. Vibration of loose structures within the heart, i.e., chordae tendineae or valvular tissue. Murmurs that occur when the ventricles are contracting, that is, during systole, are referred to as systolic murmurs. Murmurs occurring when the ventricles are relaxed and filling, that is, during diastole, are referred to as diastolic murmurs. Initially, there are 6 characteristics which you should consider in murmur identification and differentiation. 1. Location, or the valve area over which the murmur is best heard. This is one clue to the origin of the murmur. Murmurs of mitral origin are usually best heard at the apex. Tricuspid murmurs at the lower left lateral sternal border. and pulmonic murmurs at base left. Aortic systolic murmurs are best heard at base right, and aortic diastolic murmurs at Erb's point, the third intercostal space to the left of the sternum. 2. Frequency, pitch, low, medium, or high. 3. Intensity. Use the 1 to 6 grading system. 4. Quality, blowing, harsh, rough, or rumbling. 5. Timing, occurring during systole, diastole, or both. 6. Radiation, areas where the sound is audible in addition to the area over which it is heard best. 2 additional characteristics may be considered as you become more adept at auscultation. These are 1. Finer timing, determining if murmur occurs early, mid, or late during systole or diastole. 2. Other changes related to respiration, position, special maneuvers, or drugs. Systolic murmurs. By definition, systolic murmurs are sustained noises that are audible during the time period of systole, or the period between S1 and S2. Forward flow across the aortic or pulmonic valves, or regurgitant flow from the mitral or tricuspid valve may produce a systolic murmur. Systolic murmurs may be normal and can represent normal blood flow, i.e., thin chest, babies, and children, or increased blood flow, i.e., pregnant women. Early systolic murmur. Early systolic murmurs begin with or shortly after the first sound and peak in the first third of systole. Early murmurs have the greatest intensity in the early part of the cycle. The commonest cause is the innocent murmur of childhood, to be discussed later. A small ventricular septal defect, VSD, occasionally causes an early systolic murmur. The early systolic murmur of a small VSD begins with S1 and stops in mid-systole, because as ejection continues and the ventricular size decreases, the small defect is sealed shut, causing the murmur to soften or cease. This murmur is characteristic of the type of children's VSD located in the muscular portion of the ventricular septum. This defect may disappear with age. This next example presents such a murmur. Listen next to the sounds taken from a 20-year-old female with a small muscular VSD. The recording was taken at the left lateral sternal border.